We're good.
Who wants to ask?
Yep, we'll just have you start off by kind of telling us, what kind of went into the decision of going forward with the vaccine requirement here at Monument Health?
Yeah, we are excited to announce that we will be requiring vaccination of the COVID vaccine for all of our employees. This is a decision that has been deliberated and carefully thought out in order to make sure it's safe and make sure that we have the approval, which we did, from the FDA. And so we will be requiring that of our employees, all of our employees. And December 1st of this year will be that date.
What motivated this decision? Were we not seeing vaccination rates among staff where we would like to have seen them?
Yeah, so the main motivating factor is we want to prevent more severe illnesses and, of course, deaths. And you can clearly see the timeline was we got the approval for the vaccine, and then we had to do our internal, making sure that we can march this out in a meaningful way and a manner that is organized.
So why is December 1st the deadline for vaccination?
Yeah. The deadline date is based on giving everyone a fair and just opportunity to get through the process of, the logistics of getting vaccinated in a timely manner. That's why the December 1st date.
Can you talk about where you guys sit currently with vaccination rates amongst Monument staff, and where would you like to see those at?
Yeah, we're currently a little over 55% of our employed staff, and we expect that with the requirement, we should get up to 80 or higher.
Will you be making vaccination opportunities available for staff, or are you just providing them with information where they can?
Yeah, we're doing a couple of things. One, I will be presenting several, presentations, mostly a town hall style. I'll present, and then we'll have a lot of question and answers. So folks still unsure about anything to do with the vaccine can get their answers, and then that will lead to them going ahead and feeling comfortable to get it. And that's the way we'd like to see this marched out. We'd like our employees to understand why this is important and also understand the risks they're facing by not getting vaccinated. And you can see we're seeing in the hospital anywhere from 88 to 91% of different settings. So 88% is a general medical setting, and 91% in the ICU are unvaccinated. So you can see the vast majority of our patients are because they were not vaccinated, and unfortunately we're seeing the consequences of that.
Does the timing of this announcement have anything to do with the Biden administration's announcement from last week, 2 weeks ago?
That timing of this is entirely internal. We've been working on this for a long time. In fact, once we started the initial march out, we were waiting for the FDA to grant approval, so that way then we can have the confidence to tell our employees that we are and these are kind of, again, we are a health system, and that's our to do the right thing to safeguard our patients and families and get the vaccination rate up.
So for people with exceptions, I know the press release said that they'll be required to wear masks and social distance, but will there be any testing requirements? Like, will they have to get tested for COVID once a week if they have an exemption?
So exemption will be based on them filling out a specific form that'll give them that opportunity to say why. And there are two grounds. One is medical. Another one is sincerely held religious belief. And for those that get that exemption, then they'll have to additionally comply with stringent personal protective equipment standards, which would mean that they will stay masked regardless of the status until we're out of this pandemic.
Are you concerned at all about workforce not taking this particularly well? I know there's been concern about workforce in the past few weeks, especially when it comes to being stretched so thin.
Yeah, that always remains to be seen. We expect that our workforce, with the mission of our health system to do the right thing every day, we expect them to take that sincerely and to get vaccinated to help us save lives.
And if
Oh, go ahead.
if this isn't taken seriously, if somebody doesn't meet that December 1st deadline, what does that mean?
Yeah, this is a requirement just like the flu requirement. So if they don't and they have an exemption, and then, like I said, they have to comply with some personal protective equipment standards. Beyond that, that'll be up to the Human Resource Department to contact those folks that are still not getting the vaccine, and they have a plan that'll be based on the Human Resources Department.
So you said there's about 55% vaccine employees that have the vaccine already. I guess what does that say to you about sort of the state of this pandemic and the information that is out there when employees in a health system are just over half vaccinated?
Yeah, the pandemic got the whole world by surprise and led to a lot of confusion. As you can see, the messaging as the virus was discovered and its nature became more clear, and the amazing vaccines that were researched and made and quickly possible. But that contributed to many folks, not just our employees, but you can see across the state, in our city, in our communities, getting a lot of misinformation. And that's what I've done with, coming in front of you folks. We have regular weekly presentations that I give. I'm on radio. We try our very best to dispel some of those myths and make sure that people understand the risks, so that way they understand the benefits of what is really a miracle of modern medicine, that we have a vaccine that is not only very safe but very effective. And again, the numbers show it, right? Our hospitalization numbers. So almost anywhere from 88 to 91%, depending on the setting, of the patients being admitted with COVID are unvaccinated.
So going along with, talking about the patients in the hospital that are unvaccinated, the ICU numbers have been trending upwards, death rates are sort of getting higher. So do you have any sort of trends that you're noticing besides vaccination? Any updates on, hospital capacity, anything like that?
Yeah, we're quite thankful that we have a vaccine, because this could be far worse, because two reasons why. And the last year, pretty much every variant was an alpha variant, and you saw rising numbers. With the Delta, you should see double that or even more than that. And fortunately, because of the good amounts of those over the age of 65, almost 80 to 90% being vaccinated here in our county, we're not seeing the kind of really severely ill elderly ages. What we're seeing, though, is those in the 20s, 30s, and 40s. And it's sad to say this, but we've seen several deaths in that 20, 30 age groups because of the Delta variant and because of not being vaccinated. So vaccines save lives.
What about children under 18?
Yeah, we're just beginning to see a couple of cases. Right now, we only have 2 below the age of 18. So pediatric cases are a real concern. We anticipate, just like everywhere else in the country, to see more pediatric cases in the coming months.
The Department of Health says that our ICUs are full in South Dakota, so what does this mean for Monument? What are we seeing?
Yeah, at Monument Health, we have 39 ICU beds. They are full. We have an additional 9 beds we have made possible. ICU beds are not just physical beds. They come with all the equipment, the high technology support devices, and more importantly, staff that are able to have that skill set needed to take up a critically ill person. So we are maxed out. The stress on the health system is real, which is why we keep saying go get vaccinated, because those folks that get in the critical care setting, 91% are unvaccinated, and that is really putting a strain on the system. This can become unsustainable if we continue to see this go on for the next 3 months. But for now, what I would say is of all the people that are getting admitted that require critical care, all of them are pretty much all of them are unvaccinated. The one case that we have right now who's vaccinated, that person has other underlying comorbid conditions that puts them at high risk.
In your press conference, in your press release, that you say, specifically physicians and caregivers, does this requirement extend to support staff, contractors, administration?
So when we say employees, every single employee is included. Doesn't matter if they're not directly involved in patient care. Every single employee of the Monument Health system will require to either get vaccinated or have a exemption.
Yesterday, the governor tweeted about monoclonal antibodies that they work. She said that you should get the vaccine if you so choose to. Are those two messages kind of frustrating?
Yeah, what you have to remember is there are different modalities to treat COVID. So for mild to moderate cases, we're not talking severe cases, you can use monoclonal antibodies. They have no role in the ICU. They don't work if you're already severely ill. So the next point is there is one solution to stopping the pandemic, and that is vaccination. If we can get to 80% or higher vaccination in our community, we would have come a long way to stopping this pandemic and stopping a new surge and stopping a new variant.
So, back to patients hospitalized. Have you had many, I guess this is a really big complication, but have you had many patients come in with symptoms of long COVID? And so, like, if so, what are you sort of seeing in those?
Yeah, long COVID is a post-acute viral syndrome. In other words, once you get the disease, a percentage of folks, we're not exactly sure what that is. It can, depending on the study, it varied from anywhere from 10% to upwards of 50%. They continue to have symptoms well past 6 months, even though they've completely recovered from the disease itself. Those folks don't come to the hospital. A vast majority of the time, their illnesses are treated as an outpatient, and so we see them in the clinics, and the treatment for that is based on their symptoms. And that's an unfortunate aspect of it because several of these folks have staked their quality of life by not vaccinating when the vaccine was available. And now that we have a vaccine, I would urge everyone to get it because you do not want to get long COVID or COVID because your quality of life is going to be diminished and you're squandering away the better years of your life by not taking the vaccine. Those are the risks and they're real. We're seeing it in the ICU. It's very sad when you see a 30 or 40 or 20-year-old die in the ICU, and we're seeing that.
Was there anything else that you wanted to mention?
Go get your shot, South Dakota, save lives. My usual.
You gotta get some t-shirts made.
Yeah, just start